Now, in connection with the menstrual disorders, some of the previously asked questions, repeatedly asked question, Asherman syndrome is actually amenorrhea due to any endometrial adhesions or previous pathology. Premature menopause means secondary amenorrhea before 40 years. Normally it should happen after 40 years, but if it occurs before 40 years, it is called premature menopause. And most common cause of dysfunctional uterine bleeding, that is, patient is presenting with severe uterine bleeding, but after testing the hormones or after testing the USG, everything is normal, no pathology. In such cases, the most commonly due to an endocrinopathy. Okay. Now, potato ovary, the special cystic appearance of the ovary that is characteristically seen in polycystic ovarian disease. Most common of all gynecological disorders, actually, it is the dysmenorrhea. Now, what do you mean by Kallmann syndrome? Kallmann syndrome is nothing but amenorrhea, primary amenorrhea along with anosmia. Important, previously asked question. Now, menorrhagia, that means the increased menstrual bleeding. Actually, the definition means if the flow is greater than 80 ml per cycle, then only we can say it is the menorrhagia. The most common type of dysmenorrhea is the spasmodic variety. Other two are congestive and membranous variety. Okay. Congestive variety, membranous variety, and spasmodic. And most common is spasmodic. Most common cause of secondary dysmenorrhea. Secondary dysmenorrhea means during the primary, after the menarche, for the first time or for the few years after the menarche, there is no dysmenorrhea. But in such a patient, if suddenly severe dysmenorrhea appears, especially after the marriage or after the middle of the mid reproductive cycle, mid reproductive age, we have to suspect a condition called endometriosis. Okay, so that is the most common cause of secondary dysmenorrhea. Okay, endometriosis. We will discuss what is endometriosis later. Mittelschmerz means ovulation pain. Okay. Now, another important terms. First is oligomenorrhea. Oligomenorrhea means the cycle length exceeding 35 days. That is the oligomenorrhea. Hypermenorrhea means if the cycle lasts only for 1 or 2 days, like that of the medicine euphrasia, the only flow only for 1 or 2 days. We have studied in keynote. In polymenorrhea, many shortened cycle will be there per month. And most common cause of secondary amenorrhea is pregnancy. That is important. But if it is asked like most common cause of secondary amenorrhea in India, the answer is not pregnancy, it is endometrial tuberculosis.